when the prescription is the problem was a presentation about the dangers of prescription drug abuse and the ways that seniors, and anybody for that matter, can get in trouble in terms of taking medicines that are legally prescribed for them. Prescription drug abuse is a problem in our society today and has received attention at the federal level as well as the state level in terms of things that we can do to prevent it and to address it among the population. So here in the state of Missouri, one of the things that this program was intended to do was to provide some advice for seniors, particularly about ways that they can help prevent prescription drug abuse and help keep themselves safe as well. So first of all, one of the things that I recommended to seniors is that they should be careful about any medicines that they have and are keeping in their medicine cabinet at home or in their kitchen, because that's the source many times of these medicines that people obtain illegally, whether it's family members or guests just coming into their home. The second thing is that is specifically for seniors, that I advise them that anytime they receive a medicine, particularly painkillers is what we're talking about, anytime they get a prescription for a painkiller, they should only take it for as long as they need it. They shouldn't take it beyond the time when they actually need it, and really should work hard to get a non-narcotic painkiller as they go along and as their condition improves. The other thing is to make sure, let's think about whether or not they really need a strong narcotic painkiller, and whether maybe something like a Tylenol or ibuprofen or one of the non-controlled substance medicines may be appropriate to use. And then the last thing I think that I particularly want to caution people to do or advise them to do is to consider non-medication therapies as well. So if someone has a chronic pain condition for which narcotics may be indicated, perhaps there are some non-medication things that they can do. Yoga might be one of those things. There might be a very good acupuncturist that might be able to benefit them. And physical therapy may be something that could be appropriate for patients instead of painkillers. It's important to be aware of and not be afraid of prescription medications, but they should definitely be aware that they're very serious medications and that they should use them with caution.
Right, thank you very much. And I do have one more question for
Yes.
you regarding to since you have given a presentation. There's a movement up at the Capitol Hill
Yes.
regarding to this whole thing we're talking about. What is your opinion on it?
So, great question. So, it's what they're working on. There are several bills that have advanced that call for Missouri to have a prescription drug monitoring program. We are the only state in the United States and territories that doesn't have one. Now, that said, I'm hearing a lot of pushback on it, and there are a bunch of reasons that people are giving, because the problem is, out of all the other PDMPs in the other states, they have they have them in place, but they're not all effective, and so they look very different. None of them look alike. So the result is that Missouri has the opportunity to have an effective prescription drug monitoring program if we learn from what other states have done and what hasn't worked, what has worked in that. But I would say also that a prescription drug monitoring program is not the answer to prescription drug abuse. It's not the only thing that we need to be doing. There are lots more things that go along with it. The prescription drug monitoring program is just one step, one piece of the effort to address prescription drug abuse and illegal drug abuse as well.